Hello, my name is Aaqil Khan, and I'm a member of KSB Hospital's management team. I'm also the director of one of our grants, which we'll touch on here shortly. I'm wearing purple today in honor of International Overdose Awareness Day, August 31st. Started in 2001, International Overdose Awareness Day has grown into the world's largest annual campaign to end overdoses. This is a day for us to remember, without stigma, those who have passed from drug overdoses. It is an opportunity to acknowledge the grief of the families and friends left behind. This campaign spreads the message about one of the world's worst public health crises, the opioid epidemic. It is an opportunity to recognize the tragedy of drug overdose deaths, and most importantly, that drug overdose deaths are preventable. Our area has been working to reduce the devastating effects of opioid use disorder and substance use disorder through a federal grant from HRSA. As I touched on earlier, the grant's name is Project Open, and it was started in 2018 to identify gaps in services and opportunities to better serve individuals and families struggling with substance use disorder. Project Open operates in three primary domains: prevention, treatment, and recovery. We have developed and implemented solutions in all three areas to help reduce fatal and non-fatal overdoses. It's important to note that substance use disorder is a spectrum. Some people are actively using and not ready to seek help. Some are using and trying to find help. Some are actively in treatment. And some are getting ready to enter recovery or are already in recovery. Tailoring solutions to meet individuals where they are at was key to Project Open. It all starts with education. The biggest thing is creating awareness that substance use disorder is real, that it impacts lives and families in our local communities. And we really started that with community prevention messaging through a speakers bureau of subject matter experts. We called it our Tuesday Talk series. We have over 16 hours of content across 20 videos of wide-ranging topics, again, touching on prevention, treatment, recovery. You can check out them on YouTube or www.theprojectopen.com underneath our Tuesday Talk series. For those individuals who are actively using and not ready to seek help, the biggest things we can do are harm reduction and prevention. One project we launched earlier this year was a mobile wellness unit providing a syringe service program, but it was a lot more than exchanging clean syringes for used syringes. There are wellness kits, there are other linkages to treatment. And the idea over here is by reducing harm, right? A 6-cent needle can prevent a $600,000 Hep C treatment or a $1.2 million HIV treatment. By just offering that service, we begin to help people use safely, reduce the risk of overdoses and infection, and we begin to create that linkages to treatment. Another thing that the area has done is local EMS, fire departments, first responders are starting to do leave behind kits. So when they respond to an incident that might revolve around drugs or substances, and there may have been a near overdose event, a non-fatal overdose event, they're providing leave behind kits. This has again, access to treatment, information on treatment, and most importantly, Narcan, which is another thing that Project Open has really been doing, is increasing access to and the use of Narcan. Narcan, otherwise known as naloxone, is an opioid reversing agent. It helps reduce the fatal effects of an overdose and helps save lives. We surveyed all county facilities at the beginning of the project and asked who had access to it, who doesn't, who would want access to it, and we help train individuals and provide supply chains so those facilities could have access to Narcan. It's a very simple drug. It's protected by the Good Samaritan Act, so if you use it on someone, it cannot hurt them, it can only help them. Another area that we focused on in the prevention, again, for those even starting the use before it begins, was opioid academic detailing. In our planning phase, we did a key informant survey where 47% of individuals identified receiving their first opiate supply from their doctor's office. And so we really have been working with prescribers on pain management strategies, alternatives to managing pain, use of the Illinois Prescription Monitoring Program, with the overall goal to reduce the prescription of opioids and reduce a dependency from beginning in the first place. And one huge project that we've done on the harm reduction and specifically the prevention side is increasing the availability of school-based health counselors. Project Open helped hire multiple school-based health counselors to meet the unmet social and emotional need of children in schools. If we truly want to impact substance use disorder and prevent it from happening in the first place, we really have to focus on prevention and addressing childhood trauma. And Project Open really worked to increase the availability of services in schools who were not getting the attention that they may need. For individuals, again, on that spectrum, for individuals who are actively using and might be ready to get help because they've been actively engaging in a syringe service program or got information from a leave behind kit, Project Open's been working on building linkages to treatment. You may have heard of our Safe Passage program, which helps individuals who need to get help come to the police department, turn in their paraphernalia and drugs without fear of incarceration, and get help placed into treatment. Dixon was the second program in the country to do this. And through Project Open and Sauk Valley Voices of Recovery, who we'll talk about here shortly, we've expanded the Safe Passage initiative to multiple police departments in Whiteside and Ogle County. We also are working on implementing and growing jail-based services when individuals who are struggling with substances are involved in the judicial system. If we can begin treatment in the jails, we can help their linkage to treatment with providers on the outside and reduce overdoses. Oftentimes what happens is an individual who is using, once they leave the system, the jail system, they return to use, and they return back to the quantities that they used to use prior to being incarcerated. And that oftentimes leads to fatal overdoses. If we can create bridges in jail and bring treatment into the jails, we can save that return to use, save that overdose, and ultimately save lives. And we're very excited to be exploring the introduction of medication-assisted recovery in one of our local jails. And I'll touch on medication-assisted recovery here soon. For those who are trying to get into treatment or who are in treatment, improving access to treatment and other services has been a huge focus area for Project Open. Again, 3 main domains: prevention, treatment, and recovery. And so access is huge. We've worked to implement detox in local hospitals. This is for an individual who's getting ready to enter treatment, but they're not medically stable. Our local hospitals are developing protocols and care teams to be able to get them stable to then enter a residential or inpatient treatment. We've helped expand access to medication-assisted recovery. There's a fantastic program that's been in existence prior to Project Open at Whiteside County Health Department. And we have brought that program to Lee County and also have worked with Sinisippi to expand their program to now have services in Lee, Ogle, and Whiteside County. Again, we mentioned that we're getting medication-assisted recovery into the jails. And so that is really a big push on helping individuals here locally instead of having to travel outside the area. Another big push to increase access to treatment is the development of an asynchronous telebehavioral health platform available 24/7 on KSB Care Anywhere. You can get free services to depression, anxiety, PTSD, ADHD, and substance use disorder. This is both for adults and pediatrics. And you can log on and begin answering questions about how you're feeling and what you're going through and get linked to treatment right away at any time of night. And lastly, especially through Safe Passages and Sauk Valley Voices of Recovery, we've been strengthening relationships with inpatient and residential treatment facilities in the state to help people get into treatment as soon as possible. There's a very small window where someone is available and open to getting treatment, and we have to make sure that those linkages are solid and that they can get in there right away before there's a change of heart or a change of mind. And again, in looking at improving services, we have just completed a culturally and linguistically appropriate service assessment that had over 60 agencies in the Tri-County, Lee, Ogle, and Whiteside participate. And that, again, is looking at gaps in services, looking at how we communicate, how we use language, how we tailor information and education to public-facing interfaces, and how do we improve that so people understand services, understand how to access them better. And our service agencies are also providing services, again, meeting individuals where they're at and what their needs are. And then lastly, those who are done with treatment, ready to enter recovery or already in recovery, again, working to prevent return to use and overdoses, is building recovery support systems in our area. Project Open helped give birth to Sauk Valley Voices of Recovery, which is a recovery community organization with the goal of raising the entire harbor of recovery and providing more recovery support services in the area. They have really become a leader in the state as it comes to defining what RCOs do and how they operate. Sauk Valley Voices of Recovery has hosted over 20 pro-social sober events. They've released multiple newsletters to create education and awareness and of resources and other individuals. They've started multiple peer support groups, unique ones for, Crystal Meth Anonymous and other type of recovery Dharma support groups. And they've also hosted RecoverCon, which again is a big part of education, where we brought thought leaders from across the country and even across the world to come to the Sauk Valley area and host a very comprehensive conference. The first one was last year at Sauk Valley Community College. There was 63 sessions, over 50 speakers. There was universities and colleges involved in providing credit hours for continuing education. It was really a fantastic production. And the next one is coming up next month in September. 23rd and 24th. So please check out recover-con.com to learn more about what we're doing in this area. We've also, on the recovery support side, have started a sober living home to help those with housing. Housing, employment, and transportation are some of the most fundamental components of someone's sustained recovery and avoiding return to use. And a sober living home in Dixon is in works with plans to have sober living homes across the area to serve our neighbors in our community. And lastly, we're building a recovery-friendly workplace Illinois initiative to help with employment, not only help those who are in recovery trying to get an employment, but we know that 70 to 75% of individuals who are actively using are employed. How do we prevent overdoses in the workplace? How do we activate employers to help their employees get help? Recovery-friendly workplace is one of the biggest initiatives on doing that. And you can learn more about that at recoveryfriendlyworkplaceil.org. And we encourage you to reach out to your employers and HR teams to try to find a way to get involved. And again, if you wanted to get connected to Sauk Valley Voices of Recovery, here's their number, 779-707-0151. And also here's their website, svvor.org. The biggest project we're doing right now in Project Open, again, to bring everyone together to reduce the devastating effects of substance use and substance misuse, is implementation of well-being care communities, which is a software program. We identified a gap during our planning phase that was basically all of us in rural, many agencies were working in silos, but we share and treat many of the same clients. Our goal is to connect all agencies on one platform so that we can work together and have it be a more patient-centric workflow. This software system is growing. We've got a hospital, behavioral health agency, the recovery community organization, working to get public health agencies on board now, as well as social service agencies, to again have coordinated case management, streamline referrals with loop closure, and data collection and integration to identify further needs. So these are a few of the ways that Project Open over the last 4 years has really been working to reduce the number of overdose deaths in our area. The overdose deaths were rising from 2018 into 2019, which was the impetus behind the federal government releasing some funding. And COVID, the use increased big time. Overdoses, non-fatal and fatal, jumped up. There's a major spike. We are starting to see some positive impacts over there, but there's still a lot more work to go. And just tying it all back into International Overdose Awareness Day, some of the goals, again, are acknowledging loved ones. You might see events. We attended an event last year called Your Light Shines in Will County, where there were candle lights, empty shoes to acknowledge those who were lost. At RecoverCon, we had these Can You See Me Now banners with faces of individuals impacted who we've lost to substance use disorder. Another goal is to send a message to people who use drugs and people in recovery that they're valued. Our services, and sometimes the way we talk about things, overlooks people who are actively using. Things like syringe service programs are tailored specifically to those individuals. Let them know that we value them, we care about them, and that really is the beginning steps to getting them into treatment and getting the folks into recovery. We've really been working as one of the goals to inform people around the world about the risk of drug overdoses. Again, that is one of the biggest goals of International Overdose Awareness Day, and we've been doing that through the Tuesday Talks podcast series, RecoverCon, and additional education events. Another goal is to provide basic information on the range of support services that are available. I hope this video today helps you know what we're doing here locally. And then lastly, to prevent and reduce drug-related harms by supporting evidence-based practices. And as I mentioned before, there's a number of things that we are doing: Project Open, KSB Hospital, the other hospitals in our agency, public health, transportation, the education system, the judicial system, law enforcement, social service agencies, all working together underneath the Project Open banner across 3 counties to reduce drug-related harm. Lastly, I want to leave you with how to recognize an overdose. Some of the symptoms or some of the telltale signs are small, constricted, pinpoint pupils, falling asleep or loss of consciousness, slow, weak, or no breathing, choking or gurgling sounds, a limp body, cold or clammy skin, also discolored skin, especially in the lips and nails. If you see this, call 911, use Narcan. These are very simple steps we can take to save a life and then begin to help people on their journey to accessing treatment and then entering recovery. I really want to thank everyone for joining us today as we acknowledge International Overdose Awareness Day. It is a day and a time to remember. It is a day and a time to act. Again, my name is Aaqil with Project Open. Thank you again, and wishing you all a very safe and happy day. Thank you.